ALS, or Lou Gehrig's disease, is rare. It is unforgiving. It now affects about 30,000 people here in the U.S., with 5,000 new patients diagnosed every year.
As CBS 13's Brad Rogers shows us, there's now some new hope to slow the progression of that disease.
Ready, Dad? Really open her up. Ooh.
Todd DeMule can no longer walk on his own. It all started when he fell.
A couple days later, I just wasn't feeling good, like my leg, my back hurt.
Doctors tried physical therapy and shots in his nerves.
But it didn't help my leg, and by now my leg is kind of dragging.
His doctor kept doing tests until she realized what it was.
And she said, "Have you ever heard of Lou Gehrig's disease?" And I was like, "Yeah, I've heard of it, but I don't know."
Amyotrophic lateral sclerosis, or ALS, a rare neurodegenerative disease causing progressive loss of muscles and eventual death.
And when I saw life expectancy 2 to 5 years, I was like, what?
Until there's a cure, we're not going to change it, and we just try to live every day like it's our last.
Now, a doctor in Houston believes he's found a way to slow its progression. In diseases like ALS, macrophage, a type of white blood cell seen here, becomes inflamed, affecting nerve cells in the brain and spinal cord. Neurologist Stanley Appel has developed 2 drugs. One enhances anti-inflammatory lymphocytes, the other expands T-regulatory cells to block inflammation.
That combination seems to give a extremely promising outcome in this limited trial.
We are using both drugs together to mitigate the damage in ALS done by this heightened inflammation.
For Dr. Berman, this is personal. His dad had ALS.
I would have loved to have more time with my own father.
The 2 are now seeking FDA approval for a larger study.
The key is, let's enhance quality of life, and then let's enhance quantity of meaningful quality life.
I've been told that ALS is way underfunded, so I feel like, any strides for these patients is wonderful.
With something like ALS, where there's no cure, nothing really out on the market right now, anything that we have a shot at trying, I feel like is really worth it.
Of course, if they came out with a pill that said, "Hey, look, you can gain 10 years," you know what I mean? I would consider it, but at the same time, do I want to put my wife and my children through 10 more years of this? At some point, their life has to move on.
Todd is already preparing for when he'll need a device to communicate using only his eyes.
We have already banked my voice, so later on, if it does get to the point where I can't talk, they'll be able to use my voice.
While he hopes for a cure,
I can do some things myself.
He says he and his family are at peace.
It was awful, consuming. And then this peace came over us.
My life is in the Lord's hands 100%. I trust him 100%, and when he decides to take me, he's going to take me.
It's difficult, there's no doubt about that, but it's very much a privilege to be able to take care of my dad.
Can I have my iPad, please?
Todd knows it will get worse, but he's making every day count.
What you see is what you get, and every day is a blessing.
In Bedford, Brad Rogers, CBS 13 News.